Don't miss a beat. This is the theme for World Heart Day, which will be celebrated on 29th of September every year. Hi, I'm Dr. Naveen, Lead Consultant in Department of Cardiology at Aster Hospital Whitefield. Why World Heart Day? The incidence of heart disease has been increasing in last few decades. In certain studies, it is almost the prevalence is more than 10% in general population, which is very much worrying. And also what's worrying is that it is one of the causes of sudden cardiac death and also one of the commonest cause of premature death in younger individuals. That's why we need to address this issue, and that's why World Health Organization has celebrating World Heart Day every year on 29th of September, indicating the need to urgently address this issue. Although these stats are worrying, but the good news is that most of these heart diseases are preventable by taking very simple preventive measures, which are as follows. Firstly, move more. Keep yourself very active. I don't expect you to do a marathon every day. Have a brisk walk for 30 minutes a day, at least 5 days a week, contributing for 150 minutes of total cardio per week with 2 days of strengthening. That's what is required to keep your heart healthy. Secondly, eat smart. Be mindful of what you eat. Diet which is less in carbs, less in fat and less in salt is what is advisable. Diet rich in fruits, vegetables, cereals and nuts are very good for your heart and helps to keep your arteries clean. Limit the intake of saturated food, processed items, food rich in salt, etc. Third point is that know your numbers. Make sure that you get the screening test for your risk factors on an annual basis. When it is abnormal, you can do it once in 6 months, which include simple tests like blood pressure measurement, sugars, cholesterols and diabetes screening. That's what we need to be checked every 6 months to make sure that you pick up the risk factors early so that you can prevent a heart disease in the future. Fourth, listen to your body. Most of the times, the heart diseases will always give you signals. Signals like chest pain on exertions, breathlessness, palpitations, giddiness, sweating, etc. Sometimes vague symptoms like tiredness when you walk, etc. can also be a sign of heart diseases. Identifying these symptoms early can help you prevent a potentially life-threatening cardiac disease. Finally, on this 29th of September, let us all commit for a healthier living and not to take a single moment for granted. At our department at Aster Hospital Whitefield, we value this commitment. We emphasize on preventive cardiology and concentrate more on preventive cardiology as much as we concentrate on treatment of the heart diseases. Thank you.